Onamia, Minnesota. A fully equipped, fully staffed rural hospital is operating at capacity. Doctors are seeing their usual volume of patients, MRI machines are humming, and the emergency room is open. Physically, the medical center is perfectly healthy, but in the administrative wing, the facility is quietly starving to death. A billing administrator stares at a digital dashboard. For weeks, the paid column on the screen has been completely frozen at 0. The federal government recently mandated a new Medicare billing software architecture. It was supposed to make funding pipelines faster and more efficient. Instead, the newly implemented portal refuses to process a single claim. Every time staff try to submit a bill to keep the facility running, the system returns a vague, 2-word prompt: technical error. That invisible digital bottleneck has entirely severed the facility's revenue stream. Operating costs continue to climb in the physical world, but the required funds are trapped behind a broken gateway. A critical community safety net is about to disappear, not from a lack of doctors, but because a software portal simply says no. For decades, rural healthcare has survived on a very specific financial drip. Hospitals provide the care, submit the paperwork, and wait for federal reimbursement. It is a fragile loop, completely reliant on a constant, predictable cash flow. To speed up this pipeline, the government rolls out a new Medicare billing software architecture. The promise is a streamlined, unified digital portal, a modern upgrade designed to eliminate administrative lag and accelerate payments. Onamia's sole hospital facility dutifully transitions to the mandated platform. Administrators migrate their patient data, align with the new compliance metrics, and begin processing daily claims. At first, it looks like a standard software deployment, but almost immediately, the process stalls. Staff input the required billing codes, attach the digital records, and hit submit. Instead of a confirmation receipt or a pending transfer, the interface simply freezes. An unresolvable prompt appears on the screen. It cites a technical error within a newly implemented Medicare billing system. It is not a missing signature, a localized typo, or an exhausted patient limit. It is a blank, structural refusal from the software itself. The hospital is doing everything exactly as instructed by the new federal guidelines. Yet the promised efficiency of this digital upgrade has simply stopped the money from moving. In any standard institutional failure, there is an emergency lever. If a network goes down, you pick up a phone. If a server crashes, you print a physical invoice. But the administrators in Onamia quickly realize that the new Medicare billing software architecture has eliminated the analog world entirely. There are no paper backup forms. There is no secondary routing channel. The system was designed to be perfectly enclosed, which means when the digital portal freezes, the physical facility is paralyzed with it. Every MRI scan, every IV drip, and every hour of a nurse's time must be validated through this exact digital gateway. The physical hospital continues to function at full capacity. Ambulances arrive and patients are treated. But without the digital clearance, the federal pipeline remains permanently shut. The staff are now trapped inside a cascading malfunction of critical service delivery systems. They are watching a vibrant medical center drain its cash reserves in real time, placing a town's only hospital on the brink of closure. The existential threat to Onamia's sole hospital facility isn't a lack of patients or a shortage of doctors. It is the terrifying realization that there is no manual override. The physical world must simply wait while a technical error commands the room. The paralysis in Onamia is not an isolated glitch. It is part of a growing pattern of critical civic and utility infrastructure failures. Our essential physical systems are now entirely subordinate to fragile, interconnected architectures. In California, the San Francisco public utility grid repeatedly collapses. Local supervisors blast PG&E, launching a formal inquiry into the public utility system. In New Jersey, a localized fault, a single substation malfunction, plunges Hackettstown into darkness. In Tennessee, Nashville Electric Service administrators are forced to publish a post-mortem analysis. They are detailing the failures and fixes required after the historic Winter Storm Fern outage completely overwhelmed the grid. And the fragility is not just domestic. On April 6th, a major outage hits Russian banking apps and regional metro payment systems. Commuters are physically blocked from boarding trains because their digital wallets cannot communicate with the locked transit gates. Everywhere, the promise of these upgrades is a seamless delivery of essential services. But the reality is a cascading malfunction of critical service delivery systems. A severe storm, a routine software update, or an unexplained server timeout can instantly sever thousands of people from power, funding, or transit access. There are no physical backup keys to open the locked Russian turnstiles. There is no manual switch to force power back through the Hackettstown power substation. And there is no paper form to bypass the newly implemented Medicare billing system in Onamia. Across the globe, physical infrastructure simply stops functioning, waiting for an invisible digital authority to come back online. While city supervisors call for an inquiry into their public utility systems, the billing department in Onamia is still waiting. Utility administrators can publish post-mortem analysis reports detailing failures and fixes, but a post-mortem report cannot process a Medicare claim. Inside the hospital, the physical reality is still marching toward a quiet collapse. Doctors are still working, and the facility's daily operating costs are still climbing. An administrator sits in front of the mandated digital dashboard. They refresh the portal. They try to push the claims through one more time. The screen loads, and the exact same prompt appears. Technical error. There is no timeline for a fix, and no alternative way to get paid. The staff just has to wait, hoping an invisible software patch arrives before they are forced to lock the physical doors.